Good afternoon. Welcome to Wednesday Live with me, Vinod James. Welcome to Neethu's Academy Reading. How are you all? How were your studies going? You were eagerly waiting as we were all waiting. Did you all, did all those things that we have told you, what we have told you to practice, how you're practicing, how you have to underline, all those things are you all eagerly following? I hope you are. Yes, excellent. I know that you're all great students who would always abide by the rules and regulations which has been conveyed to you. Excellent. Our students are piling up. What are the things that we have for you? Sarah Thomas, good afternoon. We have an array of exams that we give training. If you want to get more insights about it, please do not hesitate to contact the number which is on the screen. And as you can see, our next available batch for this particular exam is only available from October, November, and December. Aparna Akhil, good afternoon. Why October, November, December? That shows the amount of trust that our students have in us. Vidya Vijayan, good afternoon. How am I? I'm doing good. How about you? Okay, so if you want to get enrolled and if you want to get more professional approach, yes, why not? Do have it. If not, that is why for all those people who doesn't have time, who have a lot of other constraints, that is why we come in front of you with this live session on a weekly basis. Steffi Benny, good afternoon. Namita Shaji, good afternoon. Now, the only request that we have is please do like this page, share the page, do follow us, do subscribe to our channel. That's where or how you can show the support that whatever that we are doing for you, it is beneficial. So the numbers are always increasing, and of course, we know that you all do enjoy. We hope it is the reality. So the only request that I have is please do share the link what you're watching, because there are n number of students who are still unaware that we are doing free sessions like this. So the smallest share can have a significant impact on another student. So please do that nobility. Jobita Thomas, good afternoon. Jarina, good afternoon. Anjana Suraj, good afternoon. A very, very, very good afternoon to all my lovely students. Good morning, good afternoon, and good evening. Because why I told all these? Because there are n number of students from all these different time zones. Because it's an international class that you're attending. We have students from every part of the world. And that's the beauty when I come in front of you. That's the most privileged thing that any trainer can ask for. Isn't it? The diversity that you bring to us. Salini Narayanan, good afternoon. Drishya Pradeep, good afternoon. Lakshmi Nair, good afternoon. Anju Kunjus, good afternoon. And we have two Telegram group only. Again, I keep on emphasizing this on every live. We have only two Telegram group. We do not have any other group. Why it is? We have an official Neethus Academy Telegram page, which we have just pinned. The link, just click that. It will be taken straight into the Telegram group. It's a free group. And then we have a reading exclusive Telegram page. That is also free, but we accept you only after scrutinizing. Why scrutinizing? There are a lot of fraudulent people available online. We want to make sure that our students get the ample amount of leverage on the aspect, calm and composed place where you only have people who are here with a purpose so that you will not be disturbed. Neethu Thomas, good afternoon. Smita Shiva Prasad, good afternoon. And do not forget, day after tomorrow, Neethu Madam is going to come live with a new self-prepared writing depiction case note. So do clock in. Do not forget. Do keep your time. This is why I ask you to like our page, follow us so that you will not miss any of such kind of important thing that is coming in front of you. Excellent. Arengilu Ondo, attending for the very first time. Anybody who's attending the class for the very first time? Anybody like that? If so, please do let me know that you're attending for the first time. And on top of that, where you're from. Shija EJ, good afternoon. And also, thanks for all the support. Okay. Most of the students, when your names are read, you have at least one icon which is next to either a heart shape, a hand, a flag, number one. It's a minimum. So if you have not yet done that, please do that nobility because your support is highly appreciated. How are you, sir? Doing well? Hope you're doing well. Yes, I am doing well, Shija, because you all gives us that opportunity for us to make sure that we all are doing well. Why? Because the students who attend, the students who clear, the students who are ready to come out of that comfort zone and make that dream a reality is because of all of you. Sheena Tom, good afternoon. Susan Renju, good afternoon. Shija Ebe, good afternoon. Anybody attending for the very first time? ആരെങ്കിലും ആദ്യമായിട്ട് അറ്റൻഡ് ചെയ്യുന്ന ഈ ലൈവ് സെഷൻ അങ്ങനെ ഉണ്ടെങ്കിൽ please do let me know. Not for any reason, okay? Just for me to add on to my known people list. Okay, I have known people. See, for example, I have known people any part of India. I have. I have known people from Nepal because my students are from there. I have known people from Maldives. I've known people from Sri Lanka. I've known people from Mauritius, Malta, Israel, Pakistan, Afghanistan, South Africa, and different parts of other African countries. I have people from different parts of Middle East. Then, of course, New Zealand, Australia, UK, Ireland, Scotland, and Sneha Shija. Good afternoon. So as of now, nobody have told me that you're attending for the very first time. So that means all of you were there. So good enough. Bharati Prashanti, Parthasarathi, good afternoon. So are you all ready for today's session? If so, give me a quick thumbs up. Linu Amal, good afternoon. And how many of you say that immaterial to what the material that you're going to get in front of you, you're going to get full mark? How many of you can say that I will? Anybody like that who's confident with your capabilities? If so, give me a thumbs up and say I will. Namita Shaji, yes, very good. Sarah Thomas is ready. Okay, very good. CJG is ready. Excellent. See, you have to reply on the aspect because this is just a virtual background, isn't it? Or a virtual classroom. The way that only way that I could gauge on the aspect of whatever that we are trying to convey to you is on the aspect of the number of response I get. Anjana Suraj ready, Jobita ready, Steffi Penny ready, Anju Kunjus, I will. I love that word, I will. Jarina ready, excellent. Dona Sirajan ready, very good. Namita Shaji, I will. Good enough. Rekha Anulal, yes. New name, Donna Sirajan. Good afternoon. So as you all are ready and you're all eagerly waiting, the first thing that we'll be doing is we'll be showing a parts B material where you'll have the question coming up on the screen. And as soon as the question pops up, do not waste your valuable time. Just start doing. Jarina, I will, excellent, good enough. And pick an answer. Okay, and also another thing that I would definitely want, do not write the answers during the time is not yet completed. I will ask you when to type the answer. Neethu Thomas ready. Rekha Anulal, first time attending your class. Thank you very much, Rekha. May I know where you're from? If it is okay with you. Anjana Suraj, I will. Linu Amal ready. Excellent. So as you have said, you're ready. You'll have the question coming up on the screen. And as soon as the question pops up, do not waste your valuable time. Do complete your answers. Susan Ranju is ready. Vidya Ranjit is ready. There you have the question on the screen. Please do the material. Right time, I've just alluded. Sarah Thomas done. How many of you finished on or before time? All of you have got an answer? Yes? No. Anju Kunju's done. Okay, good enough. Jarina done. Okay, fair enough. Jinsi Jobi done. So all of you have an answer. Namita Shahji done. Okay. Good. Anju Kunju, yes, all right, fair enough. Now, would you be kind enough to tell me what is your answer? And the most important thing is where you got the answer from. Neethu Thomas done, Jobita done, Rinsi Baiju done, Sheija done, Jinsi Jobi done. Excellent. So, would you be kind enough to tell me what Uma Maheshwari done? Okay, fair enough. Linu Amal done. What is your answer? How you got the answer or where you got the answer? Susan Ranju done. Uma Maheshwari C. Sarah Thomas A from the last three lines. Rinsi Baiju C. Okay, fair enough. So as what how Sarah said, I want you to tell me what is your answer, where you got that from. She just saying I got C from the whole para. Anju Kunjus is saying A from the last part. Namita Shahji is saying C from the first line. Jarina is saying A from the last sentence. Asha Nair, good afternoon. Linu Amal is saying C. Jinsi Jobi is saying A from the last two lines. Okay. Fair enough. How about others? I want all of you to comment. Do not refrain, okay? Right, wrong, don't worry. First thing, you have to tell me what you got. If you have got any other answers, please do not hesitate. Do tell me. Smita Shiva Prasad is saying done. A. Shalini Narayanan is saying C. Neethu Thomas is saying C from the center. Okay. Uma Maheshwari C from the heading and the first line. Okay, fair enough. Steffi Benny A from the last two lines. Anjana Suraj done. Okay. Now, because you all said, okay, almost the answers are there. Now let's go and dissect it. Okay. So what are the important things that you have to always remember when you're doing part B is? See, part B is the smallest out of the one that you get B and C together. B will give you 6 questions, short extract, one type of question, multiple choice question with 3 answer options. The strategy is elimination method. So in order to do elimination, see, please don't read to eliminate. As you're reading, eliminate the answer options. That's the safest bet. So what are the things that you have to read? Unlike part A, you're going to read the question first. Okay, as you read the question, underline the keywords and understand the question. See, keywords means keywords, not key sentences. Don't write the whole sentences and all. The maximum that you can do is 2 words. Or let's say if the sentence is a bit too long, then 3. Fine, fair enough. Okay. See here, it is a very straight one. Main point. That is the only thing which is conveyed, isn't it? That is the only thing which is being asked. So the main point. Okay. So extract, of course, it's a guideline, and also guideline looks into certain details about it. Now, after reading, understanding the question, underlining, see, you have to read it like this, okay? The main point of the guideline extract is that new protocols on patient-related outcomes should be followed. Extract is that clinical trials related to chronic diseases should not be relied. Extract is that patient preference should be considered when deciding treatment. So this is how you refer, okay? Because question plays a pivotal role, understanding also does. Now, 2 options that you have after reading the question is, you can read the paragraph and then pick an answer, or you can read the answer option, underline the keywords in the answer option, and then pick an answer from the paragraph. I'm a person with the second option, so what I do, I'm going to underline my keywords in the question. New protocols on patient-related outcomes should be followed. So new protocols follow. That is enough for me. Now, clinical trial related to chronic diseases should not be, now this not be relied. Okay. Patient preferences should be considered when deciding treatment. So patient preferences considered. Now I'm going to read the text. See, do not skip anything. Patient choice and treatment for of chronic diseases. So patient choice. Now, what does it say? Patients' own perceptions of their quality of life, quality of health, and their preferences are extremely important element of the assessment of therapy. So the main point, what they are talking about, there are quality of health, preference, quality of life, extremely important elements. Okay. So slightly, as of now, the first sentence is pointing into C. However, now they are refuting, isn't it? Now these kind of cohesion markers are very important. They are often underappreciated. That means it's not given so much importance, or unmeasured parameter in the evaluation of many clinical trials. So some trials doesn't find the importance. But what is important? These are important is what it means. Okay. So the patient's perspective in relationship to real or perceived impact of their quality of life is particularly relevant when considering the risk and benefit of intervention. So again, patient's perspective. So these are again showing into. Now recently introduced patient related outcomes. Okay, patient related outcomes. Okay, which allow a more rapid assessment, have the potential to provide a uniform quality of life determination that is standard across all chronic diseases. Now see, new protocols. Is there any new protocols mentioned? Any new protocols mentioned? They're saying the recently introduced patient-related outcomes. Yeah, fair enough. Where is the protocol? That word protocols. That is more than one, it's a plural one. Now, new protocols. They're saying recently introduced patient-related outcomes, not protocols. That word made that difference. So that word made this answer wrong. Understood? They recently introduced patient-related outcomes, which allows more rapid assessment and have the potential to provide a uniform quality of life determination. Okay, should be followed where? That is standard across all. These two words made this answer wrong. So patient preference should be considered when deciding on treatment. That's the only thing which is mentioned in the paragraph and which gives you a clue from the very first sentence as well. So clinical trials related to chronic disease should not be relied upon as a straight eliminator because it's not mentioned. Understood how you got the answer? C. So congratulations for people who have got C. Congratulations for people who have got A. Why you are corrected? Because new protocols followed is not there. They have introduced patient-related outcomes which allow a more rapid assessment and have the potential. It doesn't say that new protocols. One doesn't say that it should be. Namita Shaji enjoying. Good enough. Shija, as always, with a new smiley. Fair enough. Thank you. Sarah Thomas crying. Do not worry. See, when you get an answer wrong, it should always spark that thing, urge into you, saying that, okay, I made that smallest mistake because of a small technical glitch, isn't it? A very minute one. That's all. We are here to help you. So do not cry. Harish Nair is also dancing. Very good. Keep it up. So people who have got the right answers, excellent. Any doubts, please do clarify. If there is anything that you want me to clarify, please do. See the word today, okay, there's a word called perception, isn't it? So perception in the way in which something is regarded, understood, interpreted, awareness of something through the senses. That's how the answer is. Okay, because we the person's perspective of that perception. So any doubts with regards to any of the questions, please do clarify. Clear, Sarah? Okay, fair enough. Sarah is clear. Anybody else with any doubt? No doubts at all. So, fair enough. Sure, no, you don't have any doubts. Clear, Smita. Okay, excellent. Understandable. Okay, Stephen. Okay, fair enough, fair enough. Right. Now, because all of you have said clear, now let's go and see what is today's party having reserved for us. Because all of you have said you will get 20 out of 20. So would you be kind enough to tell me what is today's party and how you felt about today's party? Because that how you felt about it is a very valuable thing for us. Because after that only Neethu madam makes the next material. So your valid feedback is always appreciated. So please go ahead. Fair enough. So what is today's easy material? Just nice saying, bit confusing. Okay. Kalosynthesis is how you pronounce it. Anju Kunjus is saying easy. So it's a mix of easy, a bit confusing. Okay, fair enough. Kalosynthesis. I want all of you to give us a feel on the aspect of how you felt. No matter whatever you felt, please do let us know because we have evolved with your valid suggestions. We would highly appreciate if you could give us valuable feeds on the aspect of how you felt. Namita Shaji, after joining your classes, I can manage time, especially in public questions. Am I happy? But Namita, pat yourself because it is your hard work. You should not take anything away from what you have done. We are just the bridge between you and your dream. We can just tell you, but doing is your responsibility, isn't it? So synthesis, Namita is saying easy material, fair enough. Rekha Anulal, see, okay, fair enough. Christina easy. How about others? All of you feeling easy or tricky? Whatever you feel, give us some feel. Show some limelight to our material, how you felt. Easy material, Linu, okay, fair enough. Right, so generally it is on the aspect of easy. Okay, so let's go and see what part A has in store. And before, see why we give the material early is we want you to take a printout and do as what you do on the day of exam. Okay, because you have to underline the keywords, you have to write your answers in the given space. If that space is not enough, try to write between that space. Try to do some adjustment because you're expected to do that. Clear? No doubts. Very good. Now let's go into part A material. Okay. So once the material is on the screen, what are the things that you have to really look for in part A? Little tough, Jobita? Okay, fair enough. Let's see. So under what is a strategy? Okay, strategy for part A. What are the things that you should always remember? Part A will be the first material that you will have it in front of you. Rasia Sajadizi. Once they place the material in front of you, do not touch the material, do not peek through the material, do not touch the pencil, do not look here and there. They have all the authority not to publish your result. Don't do anything unwanted which will refrain yourself from getting over the line. Okay. And the other thing is when they tell you to keep your pencil down, keep your pencil down. They find that you're writing one, at least maybe you're writing just one letter or even a point, a period. They might say that you have done something off. So they would not publish your. So please be careful. Now, what is a strategy for part A? Strategy for part A is called skimming and scanning. Skimming means quick look, scanning means detailed look. How much time do we have? We have only 15 minutes where you have to tackle 20 questions, roughly about 45 seconds per question. So skimming, you cannot take more than, just require the maximum time that you can take in order to skim the 4 text is 1 to 2 minutes. That means if you really split 15 seconds per text. This is just to give you statistics. Okay, now what are the things that you should do when you're skimming? See, you should be looking into few important things when you're skimming. You should underline the keywords. So keyword underlining is very, very important because finding the answer in part A is only with keyword reference, not about understanding about this, what is the overall meaning of the question. No, keyword reference. That is the purpose of part A. Are you able to locate specific information in quick time? Clear? Now, what are the things that you have to do? See, generally, an overview, okay? Text A, okay? Just go and see, okay, it's a medical procedure, so abnormal fluid, so it is giving me an entry. I'm not saying, I'm just going to show a table, okay? Generally, we seldom get table. So, what is that? Next, text B is about physician will perform. So, all text B would be about the performance by physician. Now see text, see this is the table. So text C table, rows and column headings are always important. And on top of that, these are bold letter words. So aspirated, fluid, condition, suggestion, diagnosis. So these are my keywords. See, there will be a lot of things. Clear, millimeter, amount of clear fluid, exudate, polymorphinular leukocyte, purulent fluid, red blood, all brown, non-clotting, a lot of things. Okay, so normal peritoneal fluid, ruptured ovarian cyst, pregnancy, ascites, carcinoma, pelvic. There are a lot of information. Okay, after underlining the keyword, now let's say after cholecystectomy. So this is after the procedure. What are the things that you have to? So A, talking about what is cholecystectomy. B, it is talking about what the specialist will be doing. D is about what are the fluids and what can be diagnosed from that. D is about what needs to be done after surgery. Then go to the key question. So there are three types of question that you're going to encounter in part A. 1 to 7, these type of questions are called match the following, where you're expected to write only the answers A, B, C, D. See, this is more easy compared to the others. Why? You just have to see where these kind of keywords are referring to. See, for example, when one seek help of physician post surgery. Now this post surgery, where have you underlined post? I know that it is there in D. I'm blindly going to do that. Why? Because that is where everything that you've done after post. So now let's see where the answer comes from. If you really are cautious about, see, you have to notify your physicians if you notice. So what are the things that you should do? It is clearly mentioned there. Understood? Now, general motive behind performing. So what is the reason why you do this cholecystectomy? So definitely it should be there somewhere in A, because that's where the general entry is, isn't it? Now see, where do you get that? Cholecystectomy is a medical procedure that checks for abnormal fluid behind your vagina and under your uterus in an area called posterior cul-de-sac. Your health provider insert. So what is the general thing? The answer is A. Now see, parts of the body that gets punctured during the procedure. During the procedure. So where are they talking about during the procedure? Let's see where they talk about. See, in this case, what happens? It is clearly mentioned in D only. After the procedure. Why? Because it clearly says complications of cholecystectomy. So something that is complication is also there. Why? Puncturing of blood vessels, cyst, tumor, and all those things are going to happen. And on top of that, puncturing of uterus and rectum. That's what the complication. So that is where you are set. So the answer is D. Now, which techniques have recently emerged to compete against cholecystectomy? I know that it is there in A. Why? It clearly says transvaginal ultrasound, okay, has largely replaced cholecystectomy because it can detect. So what is that? The answer is A. Instance that demands re-entering of needle in respected area. So I know that re-entry and all, who should be doing? It should be done by the specialist, isn't it? So if there is no fluid collected in the first attempt, the physician withdraws the needle and reintroduces it. So the answer is D. How do we get to know about bacterial infection and intra-abdominal injury? So bacterial infection, intra-abdominal. So there should be there somewhere in the table. I know that. Why? So let's see. Bacterial infection, what happens? Yes. What happens? It will have purulent fluid. So intra-abdominal injury, what happened? Bright red blood. So what is that? It is there in C. I told you. See the next one, the link between nature of fluid and condition. So nature of fluid and condition, fluid is there, condition is also there. I'm not going to worry about it. Sorry, it is there in C. So I've wrapped 1 to 7. Please be kind enough to tell me what are your total scores out of 7. In the meantime, the second set of questions from 8 to 14, these are called short answer question, where you're expected to write an answer. Can be as simple as that of a word, short phrase. It can be anything up to 3 numbers or number and word. Skimming and scanning. So these instructions should be by hearted along with the number of questions. How might aspirated fluid when diagnosed with diverticulitis with perforation? So diverticulitis, perforation, I know it is there in C. So how it is? Why diverticulitis and with perforation and all those things are there. So how should the fluid be? The answer is purulent fluid. How would you understand? Purulent fluid. P-U-R-U-L-E-N-T F-L-U-I-D. That's how you find it. The first answer. Instrument used by surgeon to examine the cervix. So instrument, cervix. So where do you think the instrument cervix? It should be there somewhere in B, isn't it? That's where the specialist is going to come with. So the physician inserts a lubricated tool known as a speculum into the cervix. So what is the instrument? Speculum. S-P-E-C-U-L-U-M. Okay. Next question. See, the first one I just realized. See, it should be purulent only, okay? Because fluid is mentioned in the question. Sorry for that, I forgot to mention. Next, question number 10. What is being applied into the vaginal lip or cervical lip once cleansed with antiseptic? So, applied lip cleansed. So, it should be there somewhere because that has to be done by the specialist again, isn't it? So, next, the physician cleanses the vagina and the cervix with antiseptic and applies 2% lidocaine gel to the vaginal lip or the cervical lip. So what should be applied? 2% lidocaine gel. That this is also important. Okay, good enough. Next, Chaldose and Thysis have been widely substituted. So I know the substitution have come from transvaginal ultrasound. So TRANAS-VIGI, so VAGINAL, ULTRASOUND. Excellent. Question 12. Area where fluid gets filled due to certain medical conditions and infection below uterus. I know it's there in text A. So what is the area? It's called posterior cul-de-sac, and cul-de-sac is a hyphenated word, so you have to replicate as such. So POSTERIOR hyphen DE hyphen SAC should how your answer would look like. What kind of discharge may be seen from vagina following a procedure? So discharge following procedure should be there somewhere in C, isn't it? What kind of discharge? So discharge is there, vagina is there. So what kind of discharge? Pus-like. PUS-LIKE. Again a hyphenated word. So please do have hyphens. What kind of bleeding longs for some time that can be diagnosed? Discolored blood. So discolored. So where are they talking about? Old, brown, non-clotting blood. So where are those? What is that? So it is clearly saying it should be, what should be the answer? It should be intraperitoneal. Why intraperitoneal? Intraperitoneal bleeding. That is what the answer is, because that is the discolored blood. And it doesn't stop when all is mentioned. So the answer is intraperitoneal. Intraperitoneal is the answer. So question number 15, the third set, these are called fill in the blanks question. The instruction remains the same, but you have to be very specific on the aspect of repeating a word again, because these are called redundancy. If you repeat an article also, it's going to be wrong. Okay. So before pulling back the syringe plunger, surgeon injects dash into the cul-de-sac. So cul-de-sac, there are two places where you have cul-de-sac, one in A and the other one in B. So A is not there. Now let's see where the other keywords. Cul-de-sac is there. Normal saline. So what does he inject? Normal saline. Normalsaline is the answer. Excellent. It is necessary to notify your surgeon outrageous. That means something which is excessive, where pad is consumed an hour, a pad. So more than a pad means more than one. So what is outrageous? Where are they talking about all these keywords? It is mentioned in D. Why it is mentioned? Excessive, outrageous, vaginal bleeding, more than one pad per hour. So all the other keywords are as such there. So the answer is vaginal bleeding. Two-word answer, vaginal, bleeding. Dash are prescribed in order to alleviate trivial pain. So alleviate, trivial, a lot of great vocabulary. So alleviate means what? That's the next thing, isn't it? Now see, what are they saying to alleviate? Let's see what are they talking about. They're talking about to relieve. So alleviate, that means to lessen. Trivial, minor, pain, which is not important, that's called trivial. So what should be prescribed? The answer is painkillers. Painkillers. Excellent. Question number 18. Exposed vaginal fold. Equipment called dash is used to hold the cervix. So expose the vaginal fold. Equipment. So what is the equipment? Where are they talking about all these equipment? It should be there in B, because that is where the physician are using, isn't it? So what is the physician using? Using a tool called tenaculum. Tenaculum. Right? The physician grabs the cervix and lift to expose the vaginal fold. So that's what the other keywords are. In lieu to culdocentesis, minimally invasive or dash surgical techniques might be used. So in lieu, that's a new word, isn't it? So in a part, okay, in lieu, other than, that's called in lieu. Okay, so the surgeon might, so what are they talking about? The surgeon might use, see, surgeons may use minimally invasive or image guided. So it's a hyphenated word again. Today, this material have a lot of hyphenated words. Image guided surgical technique instead of, so instead means in lieu. Understood? That's just a paraphrase topic, synonymous language. Final question for today. Dash indicates burst in the aortic aneurysm beside viscous and vascular injury. So something where it is talking about an injury, so clear liquid, bright red blood, all the other keyword, ruptured. Ruptured is paraphrase, viscous vascular injury, and all those things are mentioned. So the answer is bright red blood. So three-word answer, BRIGHTREDBLOOD. I have racked my 20 answers. Now it's high time that you start telling me if there is any doubts, please ask. If not, please do let me know how many of you have made that 20 out of 20 or whatever is your score. Please be kind enough to tell me. Any doubts? Please do clarify. If not, please do let me know what is your total score. Anju Kunju is absolutely stunning. Very good. The first person to get 20 out of 20. Very, very good. Keep it up. This is the power of I will, isn't it? Lino Amal 19, excellent, very good, keep it up. Sarah Thomas 20 out of 20, this is again the power of I will. Very good. Jobita Thomas 17, good enough, keep it up. Sharanya Manu 17, good enough, keep it up. Do we need to write pus like or pus? Pus like. It's not pus, isn't it? Pus like. Jinu George 17, good enough. Salini Narayanan 20, I will, very good. Neethu Thomas 18, excellent, good enough, good enough. Amita Shaji 20, excellent, keep on dancing. You know, you should make the most of it. You should have a merry on the aspect. When you achieve something, you should enjoy. Go ahead. Hani Prasad 18, Razia 17, good enough. Harish Nair 17, Uma Maheshwari 19, very, very good, keep it up. Good, good, good. Any doubts that you want me to clarify? Anything that you're not clear about? Anything that you want me to discuss about? Anything? Christina 19, thank you for your explanation. My pleasure. 19, good enough, excellent, keep it up. Susan Renju 17, good enough, keep it up. Right. When you're correcting, also please ensure that all those spellings, all those hyphen, all those things are looked into. If you haven't put, please mark it wrong because we are here to learn. All right, as Jobita have started saying thank you. So it's high time that we also start saying thank you, because from all of us from Neethu's family, thank you so much for giving us yet another lovely session. Until and unless I meet you tomorrow, adios from me. God bless you all. Take care. Bye.